Imagine you are a young doctor just finishing training. You experience a cardiac arrest, and in the process, you break your neck, leaving you paralyzed. You spend the next 2.5 years in hospital trying to just save your life. You become a full-time patient as a result of your injuries. This is the story of Dr. Lynn Ashdown. It's episode 12. Let's go. Welcome to Solving Healthcare. I'm Kwadcast. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Happy New Year, everybody. I want to thank you for being so responsive. Our last minicast, we talked about a call to action, getting people moving, changing the boogie, reaching out and spreading the word about what we're trying to do on the Kwadcast. And it's been amazing. We got an influx of comments and increase in 5-star ratings. And you know what? I really appreciate you guys doing your part. And let's keep moving. Let's keep spreading the word and spreading what we're trying to achieve. Solving healthcare. Today's episode is brought to you by BetterHelp. And I got to tell you, I love these guys. Okay, they provide professional counseling that is accessible, affordable, and convenient. Okay, you get to connect with these professionals via video chat, via phone call, via email, whatever is the most convenient way for you to receive professional counseling is how they'll provide it. And I got to tell you, I was speaking with Jeff over at BetterHelp, and they provide services for all, like whether it's your teenager that needs help, whether it's for yourself, whether it's for marriage counseling. They even provide care for healthcare professionals, especially like we're seeing more compassion fatigue, and they're specializing in that too. So honestly, like it's such a great service. It's affordable. If you want to reach out to them, go to betterhelp.com and use the discount code SolvingHealthcare and get 10% off your sign-up fees. And yeah, like I said, I love what they're doing out there. So you heard it in the intro. We are talking to Dr. Lynn Ashdown, and this is such an unfortunate story. As you heard, she had a cardiac arrest, which left her paralyzed and having to be hospitalized for over 2.5 years and having recurrent medical issues as a result of her injury. So after listening to her story, there's one thing that I really want you guys to take away from this, and that's the patient's experience, the patient's voice matters. And not only does it matter, it is so valuable to be able to provide better care. We will learn so much by having the patients have a voice at all levels, whether we're doing research, whether we're doing quality improvement studies, whether we're developing a new treatment center. There's so much insight that the patients can be providing. And you're going to hear that from Lynn. You're going to hear how the little things that might not be intuitive to the clinician can be so impactful in a negative or in a positive way. And as a clinician who got into this game to try and help people, hearing some of these stories really makes me feel like I wish I would have known more. I wish I would have done better. So really think about that message after listening to the episode. What can we collectively do to make sure that our patients have a voice at all levels? Okay, so without further ado, Dr. Lynn Ashdown. How are you?
I'm great. How are you?
I am wonderful. I was at the Ottawa Patient Safety Conference. I'm messing up the name, I'm sure. And you gave this testimony. You gave your story, and it blew me away. And I immediately grabbed someone I knew, Melissa Brent, said, like, she needs to come on the show. She needs to go represent, And so it's an honor that that we were able to make this happen. And I appreciate you taking the time.
Oh, no, it's my pleasure. And I'm glad that you took the opportunity to come and chat with me after, and happy to share my message and story. And I think what you're doing with the podcast is fantastic. And let's see where this can go.
Absolutely. It's going to be a good one. I feel it. So I'm just going to jump into it. Tell us your story.
Yeah, my story is pretty crazy. Everyone has kind of defining moments in their life, and there's specific times where people can really sort of say my life changed. But I really had a dramatic sort of change to my life. And a little over 6 years ago, November 27th, 2013, my life literally changed fundamentally, every part of it. And sort of the life that I was leading before that day and the life that I'm living now are two completely different lives. Almost, I kind of think of myself as the old Lynn and the new Lynn. But before, sort of that, I call that day sort of the accident day. But before 6 years ago, I was University of Ottawa grad from medical school, and I was was at the very end of my family medicine residency, had even written my final licensing exam, and I went to work that day as a full-time healthcare provider. And then my next memory is waking up in the ICU, not knowing how I had gotten there, not really being aware of anything that had happened, and found myself embarking on this journey, what would become literally a full-time journey as a patient. And when I say I'm a patient experience expert, I really, I've been living sort of the life of a full-time patient for the last 6 years now.
Unbelievable. So what happened that day?
Yeah.
The day we call the accident.
Yeah.
What happened that
day? I kind of...
Sorry, and even just life before the accident too. Like what were the things that you were doing on a regular basis? What were your hobbies? What were the joys of life there?
Well, I mean, I mentioned I loved medicine. I loved, and I still really hadn't gotten into it. I was just finishing up residency, but very passionate about medicine, loved family medicine, loved every part of medicine, actually, always that thirst for knowledge and that intellectual curiosity, but I really loved the human connection part of it. And being a physician, I truly feel it's a privilege. I mean, you're part of patients' lives at their most vulnerable moments, and that's an honor. It really, truly is, and it's a privilege to be part of patients' lives in that way. And so obviously, I'm sure, as training in medicine takes up a lot of your time, but I was also, I was concurrently doing my master's in medical education at the time as well. So have always been, and will sort of hear, I think, as we go on today, been interested in sort of the education part of medicine. So was doing that, but leading a very active life, loved exercise. I mean, I've been doing sports since I was, since I have memories. Zero. And I think I came out running or something because, so very physically active, kind of grew up doing every sport, did some sports at sort of a high level competition, had done, a few marathons, really any sport, physical activity was game for me. Just kind of living typical busy life of a young woman, sort of just embarking on the career, but traveling a ton, doing a lot of traveling, diehard Sens fan. Like
I'm seeing that here actually.
Yeah. You see all the Alfie and Carlson. But literally, maybe I'm aging myself, but that very first Ottawa Senators home game, I was a little child, but I was there for it. Nice. Like the very first, like way back when, the Sens, they weren't even in Canada. They were out to what was in the Civic Center. But so diehard Sens fan, and living life. Life was good.
Yeah.
Yeah.
And then the accident.
So, like I said, my last memory is I was going to work that morning, and I don't even remember actually going to work. Apparently, I did go to work, but my last memory is actually being in the car, about to go into clinic, and then I guess what had happened was I've since learned that I have congenital long QT syndrome, which is an electrical abnormality of the heart, undiagnosed at the time, but it typically about 50% of the time, first presentation is cardiac arrest. And so I was, I guess, sitting in a coffee shop. I was studying as like I always do. Loved doing all my studying at coffee shops. And I guess I was sitting on a stool. What witnesses reported was that I was sitting on a stool. And because of this congenital long QT syndrome that I didn't know I had at the time, I went into cardiac arrest. And so my heart stopped. And so when I say my life changed in a heartbeat that day, it literally and figuratively did change in an instant and in a heartbeat. And so I guess going into cardiac arrest, I fell lifeless from the stool. And the way that I fell, I shattered my skull, sort of had a frontal skull and right orbital fossa fracture, suffered a moderate traumatic brain injury, broke my neck at C3, suffered a spinal cord injury, and that just basically started a cascade of life as a full-time patient and all the medical issues that you can imagine would ensue from that. I spent almost 2.5 years cumulatively as an inpatient, not to mention even
like not just a patient,
just literally in a hospital. Wow. For almost 2.5 years combined. So you can imagine life now is very different. I'm not practicing clinically, but really the first few years, like I said, 2.5 years was spent being an inpatient, and then I'm in a wheelchair, so trying to adapt to new life from a wheelchair, completely different. I mean, it's the learning curve is, I mean, I would say adapting to life after these injuries was way harder than medical school ever was. But then also trying to figure out, my brain does not work the same. And I mean, when I first woke up, I couldn't put two words together.
Wow.
And I mean, if you had asked me a few years ago if I'd be doing a podcast, I definitely, I would have said the answer is no, really? Let alone talking at conferences and sharing my story. I mean, I had to relearn everything. So I continue to do that to this day. I consider my recovery as my full-time job right now, and I continue to improve. I've sort of reached a point where my health was stable enough that I was able to kind of use my experiences and sort of the unique insight that I gained from being a patient, to be able to start incorporating sort of, I have a very unique view of the healthcare system because I went into it with an understanding of the healthcare system, but then combine that with literally being a patient experience expert. It really has given me a very unique insight into the system and a gift in a way that I think most people wouldn't have. And I think it's my way of being able to still improve patient care, be part of, I mean, I went into medicine because I want to help people. Right. And even if I can't do that clinically, that desire, that drive to help patients and help the healthcare system in general, it's still there. So I'm just kind of doing it a little bit differently now. I have since gone back to finish my master's in medical education. Awesome. So I'm doing that part-time, all by distance education. But I've also just in the last 1.5 years started to do some work at the Ottawa Hospital with their patient engagement program there. So being a patient advisor and sort of a program lead in that, getting involved in a few sort of research projects, but also really starting to share the wisdom that I learned from being a patient.
Wow, Lynn. I mean, there's so much there.
There's a lot.
There's a lot there. I might be even speechless here. First of all, I want to say it's great to see how much you've recovered from your initial injury. Like hearing that, 2+ years ago, you don't picture yourself being able to have this conversation now. And seeing you, how bright you are, and you look actually physically fit too.
Yeah,
it's awesome to see.
Thank you. I've worked really hard for it. I mean, it didn't just sort of happen passively. I've worked really hard to get to where I am, but I'm just fundamentally, I don't think I'm designed to kind of just be passive.
Right.
It's just not who I am, and that's sort of It's in me to always be improving no matter push. What your circumstances are.
Yeah. And you certainly have improved on your circumstances. I'm paraphrasing or summarizing a bit here, but just imagine, people, you are young, vibrant, young woman, ready to, put your footprint on the medical world and help others, and out of the blue, your world completely changes with a medical condition that you don't know you have. You suffer this crazy injury, and I got to tell you, it's not common. Like for those that aren't medical, it's not common to break you were on a stool,
sitting on a stool.
Yeah, this is very rare. Like even people from a standing position would rarely break their neck and then end up with a spinal injury.
I kind of joke that you couldn't even script it for like a Hollywood movie if you wanted to.
No, it would be like
it's a bit too much.
Yeah,
exactly.
And so you have this crazy unfortunate circumstance, and here you are today with all your endeavors with the hospital, to research, through being here now to try and make a difference in terms of the patient experience. And we're going to talk about each one of these things. I want to get a sense from you, though, what was it like being an ICU patient? And I'm coming a little bit of bias because I work in the ICU, and we often get these stories about how tough it could be going through the intensive care unit. Yeah. It's not a benign treatment. And I'm wondering, do you have some recollection of that time of your treatment?
I have very few memories from being in the ICU, which, I mean, maybe from your experience, may be a good thing.
I think
it's kind of protective.
It's a good thing and protective. Exactly.
Yeah. So because of the brain injury, I really don't have a lot of that from being in the ICU. Pretty much just one or two kind of memories. One was it was really my first memory of being awake. And I obviously, like I said, I was very confused. And the interesting thing was I actually recognized the environment that I was in. Mm-hmm. And I remembered sort of as you know, from being in the ICU, kind of rounding on patients and stuff. And I remember seeing sort of a group of people, the staff and nurses and residents and stuff, but actually thinking that I was part of rounds.
Wow.
I didn't comprehend that I was the patient. I remember hearing them talking about a patient, but I actually thought I was part of rounds, and that I didn't comprehend that I was the patient, that they were talking about me. So I do have, it's a very almost like a dissociated memory, sort of hearing C3 fracture and brain and all this stuff, and, surgeries that were coming up, and sort of, just kind of hearing all the diagnoses, but actually not knowing that it was me. So my brain had started to kind of almost say, man, that person's got a long road ahead of them. I understood the severity of it from a medical perspective, but I didn't know it was me.
Didn't know it was you.
Yeah.
That must have been so.
It's very surreal.
Yeah.
It still feels like I was very detached from that, which, I likely was, whether that was protective or because of the brain injury or a combo of both. But it was a very bizarre feeling. And I would say it wasn't until I had transferred out of the ICU, and probably even in rehab, that I really started to I would say, have memories of truly understanding what was the journey that I was about to embark on as a patient.
You kind of alluded to this before, but because, you mentioned how you aren't someone that stays stagnant, that wants to grow and make the best out of, the circumstances you're in. After being in rehab or like coming to and realizing the road ahead, did this come naturally at that point, even that early on? Or is this like something that really needed to develop over the course of your treatment?
So it's a really good question. And I'm fairly comfortable. I'm quite comfortable actually sharing my story now. I do believe there's power in patient stories. And I mean, stories are what connect everybody. Mm-hmm. And so I really, like you said, it's such a bizarre story that it's a story that I want to share and that I want people to learn from. And, but I'm also a very honest person, and it's been a struggle. I mean, I'm talking about it quite comfortably now, but no, it didn't come naturally, actually. And I was very resilient, hardworking, sort of quite positive person. And and I would say the first year, I was literally just kind of fighting for my life. Mm-hmm. So there was no, and again, with the brain injury, there was no cognitive processing at all. Like I was just sort of, the memories that I have, I was just a patient, and the system was kind of doing care to me. I wasn't really part of the care, and I wasn't quite able to be part of that sort of process at that point. So kind of the first year, it was really just kind of surviving physically, get through it. And year 2 was when I think the brain injury started to settle a little bit, and I could kind of process sort of what had happened. And, I'm quite sort of open and saying that, I mean, I've got a lot of medical issues that have ensued from sort of the severity of those injuries, but really suffered from depression, post-traumatic stress disorder from sort of the accident itself. So it didn't quite come naturally. I think the resilience and the hard work in me, and sort of the drive to know that there has to be something better in the end, that was there. But was I happy doing it? Was I sort of always okay with it? No. And I would say I really, it's been a grieving process. Like I've really had to grieve the life that I lost and accept the life that I have now. And it's been a journey.
In terms of that grieving process, I can say this as a doc, we tend to put our emotions aside, especially when we see a lot of, ill patients, sick patients, sad circumstances. So we tend to compartmentalize and maybe stuff some of these emotions somewhere deep, Did you find out that was a challenge to be able to address these things? And the reason I say that is mostly because of, we're seeing a lot of more and more mental illness within our colleagues.
Yes.
Just at the time of we're doing this podcast, Ryan Sagan, he's a 24-year-old medical student, passed away, but he committed suicide. And it's just, I think we need to
talk about it.
Yeah.
I mean, we need to talk about mental illness in general, and more in society, but also within healthcare and within physicians. So it needs to be sort of destigmatized and addressed.
Absolutely.
And that's sort of why I'm quite open about every diagnosis that I've suffered, and sort of every illness, because I mean, suffering from mental illness, it's not any different than me breaking my neck or anything like that, or any of the other sort of, long-term sort of other medical diagnoses that I've had. Really, I think to destigmatize mental illness, we almost need to stop calling it mental illness. Everything's just illness.
It's just illness.
Right? As long as we keep sort of separating things into sort of physical health and mental health, we're kind of keeping it separate. But
and I mean, I've said this before, I truly believe if you're going to get better, all of your health needs to be addressed, the mental, physical, all of it. And so, I really think the importance of addressing that is paramount.
Yeah. And I mean, I think I did a really good job initially, or I did or I didn't, of not sort of dealing with the emotions. And I think, again, our bodies are really resilient. I mean, I already sort of knew that. And maybe this is just the geek in me, the medical sort of, the intellectual sort of curious person in me. But I mean, our human body, they're fascinating. It's phenomenal. And so I think in a way, without realizing, I really did need to put my emotions aside to kind of survive that first year.
Right.
But then once sort of everything had kind of settled and I was sort of through the worst part from a physical perspective, that's when sort of everything else kind of hit me. And it wasn't really by choice that I wanted to address everything, but I was literally, paralyzed by just as much by my physical health issues. Then all of a sudden, the mental health issues sort of paralyzed me. And I really do look at my recovery as you've got sort of your physical health, you've got your sort of emotional, mental health. I think of my cognitive recovery. And without sort of addressing each one of those things and the overlap between them, I wouldn't be where I am today. Like I wouldn't be able to do this podcast if I hadn't have addressed every part of my health.
That holistic approach. Wow. No, that's really good, Lynn, to illustrate the value of dealing with all those aspects of your health and well-being. So what can we learn from your unfortunate circumstances, like going through this? What can we learn either, and it's wide open, at a societal level, from a patient level, from a clinician level, going through this experience, what can we learn from?
Yeah, it's interesting. Like you said, it's kind of wide open, and probably depending on the day that you ask me, I might have a different answer because I still don't even think I've realized everything that I've learned. And it's probably going to be a journey that I continue to unpack for years to come. And I would say one of the most shocking things that I experienced, I mean, when you're an inpatient in the hospital for almost 2.5 years, you have some time to think.
Yeah.
And I don't know how you would feel, but if you had asked me before this accident happened, would I have been prepared to navigate the system as a patient? My answer would have been yes, just because of having worked in the system and understanding sort of the medical side of things, but also just understanding the system. I probably would have said quite confidently, yeah, I think I really would have been prepared. And man, was I shocked when all of a sudden I found myself as a patient really unable to navigate the system.
Wow.
And to think that I knew so much, yet I knew so little as a patient. It's a lot to unpack. And I kept thinking to myself, man, how are other people doing it? Because I mean, as much as I say that I found it difficult to navigate, I still ultimately understood the system. I had a head start on probably most patients. And
Absolutely.
So I can't even imagine what it would be like for someone who hasn't worked in healthcare, who hasn't trained in healthcare, sort of all of a sudden being thrown into this chaotic system.
Can you give like an example of a situation where it was tough to navigate?
Yeah. I'm sure you sort of hear about this from your work in the ICU, but you often hear of discharges being a really difficult transition. And being in medical school and in residency, as physicians, you kind of, well, I mean, every healthcare professional, everybody works in silos and they have their area of expertise. And so I can remember coming on call and being on internal medicine and sort of being responsible for discharging a patient. And once you check the boxes in terms of, okay, their medical issues have sort of stabilized and they're safe to be discharged from a medical perspective, you just sort of sign off and you assume that this patient goes into this world where sort of their home care services all fall into place. They have follow-up with a primary care physician. They have access to their medical charts. At least I was quite naive in my understanding of how the whole healthcare system kind of came together. I understood things from the physician perspective. And when the patient was ready to go from a medical perspective, we signed off and that was that. And you just sort of assume that everything else kind of happens.
Right.
but it doesn't. I mean, I can tell you from the number of times that I've had discharges and had to set up, I mean, I have home care every day. So just trying to coordinate that and sort of the breakdowns in communication and sort of, even having, being bounced back because sort of discharge wasn't sort of handled appropriately. And then
so like
coming back to within 24 hours because sort of the services that I needed at home, it didn't come together. And so, I mean, I live alone. So, and I have wonderful help from people, but ultimately when I get discharged, when I leave a hospital, my situation is such that I don't have someone that can sort of step in and be like a pseudo caregiver until all the services come into place. So if things aren't coordinated, I'm here by myself in my apartment. If that PSW doesn't show up or that equipment that I need from a supply perspective doesn't come as scheduled, then I have no choice but to go back to the hospital.
Wow.
Because there isn't somebody that can just hop in a car and go and pick it up or, help me transfer or something like that until the people that I need come. And so when I talk about how difficult it is to navigate the system, there's a whole system. I would say as a physician, we experience like 5% of the system.
Wow.
But then it blew my mind how much I didn't know.
And I got to tell you, this is something by doing the show, I'm learning on a regular basis how little we know about the patient experience in general, but these systems, like to think, as you mentioned, I wrote that discharge, says the home care is going to be there or whatever. Fine.
You're done.
I'm done. Yeah.
Yep.
You know what I'm saying? And it makes me think about actually Gianni DiGidio. I hate bringing your name up again, buddy. Anyway, he's a colleague of mine that gives his cell phone out to his patients. And this is exactly why he does this, to be able to make sure that the steps are in place, that not only you are cleared medically, but you're cleared to go home safely.
Yeah.
And I think I could speak for Gianni. He also had in terms of family members needing higher levels of care and really being able to see that side. And I think that's opened up things for him. And hearing that now, I hope there's our clinical colleagues out there could truly appreciate, really making sure our ducks are in a row, because there's a lot of pressure to get patients home.
Absolutely.
It's I'll give an example. At one of the hospitals I'm working at, there's X amount of admitted patients in the emergency department. There's tons of paramedics that are waiting to unload patients into the emerge, and it's just the hospital's backloaded. So you're just doing your best to discharge, but you really need to make sure these ducks are in a row. Because I'm just thinking of you, Lynn, like having to come back, like how dejecting would that be? You know what I'm saying? And emerge again, and
and I felt like a failure. And it wasn't it was a system failure rather than sort of a personal failure. But I mean, I think I'm still, I have certain expectations of myself. And, I think like a lot of colleagues in medicine, we're harder on ourselves than we would be on other people. I think that something that's in a lot of either healthcare workers, but physicians definitely. But so at least I can say that I held, and I still have higher expectations for myself. I would say I'm tougher. I'm my toughest critic, right? And, but, it does. I mean, and nobody wants to be in a hospital, right? And so, I mean, there are very few people that, if any, that truly, really, want to be in the hospital, right? Yeah. And so just the idea of having to go back there, but then also kind of taking it a little bit like it was a personal failure, like I just couldn't manage at home. And it's hard. And not to mention, I mean, you're still not feeling good health-wise, right?
That's exactly what I was
we're not
about
at
to
our
say.
best. We're at our worst when we're in the hospital.
And I mean, I'm just thinking of your story because you're in front of me. You go through all this shit, Okay. You work your tail off to get yourself strong enough, get yourself out of hospital, get yourself mentally strong to, change that environment and work on that rehab. And then boom, the shit you've been asking for to be able to get home and get home safely is not there. This is the exact reason why this show exists, man.
Yeah.
Like, people don't know this shit.
Yeah.
People don't know these stories, these little things that if you think about, I shouldn't say it because I'm not in their world, but I don't think it's that hard to get right.
Yeah.
You know what I'm saying? It takes a little bit more time. It takes a little bit more effort. But if you think of being patient-centered, or whatever the term we're going to use, like, this is what we need to do.
And therein lies, I think, one of the biggest, not injustices, but I think one of the biggest mistakes that we're making in healthcare is that we don't understand the knowledge and the expertise that patients can bring.
Yes.
And it's an underutilized resource. I mean, patients are all around us. They're right there. Mm-hmm. And they have a certain, there's textbook knowledge, and there's things that, we learn about all our medical sort of conditions and ailments and illnesses by studying textbooks or, using UpToDate or, that sort of thing. And, and that's great. But then there's a certain amount of expertise that comes from just living it. Mm-hmm. And, I'm sure you can even speak to before you had kids and after you have kids, right? And sort of, there's a certain amount of stuff that you just learn from doing it, being in the thick of it, right? Yeah. And sort of probably by your third kid, you're much more sort of casual and you understand the whole process way better than when you first bring.
We don't even know where the third kid is.
Exactly. Whereas you bring your first child home from the hospital, and even with your understanding as a physician, you're still sort of like, what am I supposed to do with this?
We're the worst.
Yeah. And so, but it's the same thing. And if we can change the culture of the healthcare system, I think we're changing it a bit in terms of a point of care perspective and including patients in their discussions in terms of their own management of their ailment. But if we can change the culture of healthcare and the system design to appreciate and value the expertise that patients can bring from being they're the ones in the trenches. And the unique thing about patients is that they're the one unifying thread in healthcare. Everybody works in silos. Mm-hmm. Nurses understand their nursing world. Physios understand the physio world. Administrators understand the administrative perspective. But what I realized from being a full-time patient is that I've understood each one of those silos in a whole different way because I'm there all the time. So I see what's happening with the nurses. I see what's happening from an administrative perspective. I see what's happening during rounds and with physicians. And I see what's happening as an inpatient. I see what's happening as an outpatient. And I see what's happening with home care because I'm living it every day. And that's brought a whole other level of expertise that really was missing in my medical education. And that's not because I had a bad education. I had a great medical education and really sort of, I think, did my best to become the best possible physician that I could be. But it's just valuing the culture of healthcare and valuing the patient voice. But also then it's not that I sort of, if any, I would say I thought that I was a very patient-centered physician the way that I practiced. Mm-hmm. But I really came to learn from being the patient that my definition of what I had been taught was patient-centered in medical school and residency actually isn't patient-centered at all. And it took me being a patient to realize that.
Yes. I think for the listeners, I want to try and think of like concrete examples of being how the patient experience might not be obvious to the clinician, and how that input from the patient could really be eye-opening and impact care in a greater way, whether that's something you've experienced or learned along the way.
In terms of when I say sort of a patient-centered system versus, I'll try to, hopefully we can elaborate on what I mean by patient-partnered, but right now I'm going to talk about sort of patient-centered versus a system-centered sort of healthcare system. And really, patients are living in a system patients are experiencing a system-centered healthcare. And what I mean by that is, for example, physicians, and even we're going into the holidays now, and, things go down to skeleton staff. But really, healthcare doesn't stop because it's Christmas or because it's a long weekend, or medical issues. They rarely happen from Monday to Friday between 9 and 5, right? But our system is kind of designed that all these services are in place, and all the coordinators, the people that need to be there to make sure that discharges happen as planned. But if it doesn't happen between that Monday to Friday, sort of 9 to 5, then the same attention isn't paid to it.
Right.
But really, if we're making, like I said, healthcare doesn't stop because it's an evening or a weekend or a holiday. People are sick when they're sick, and that's that. So if we're really going to, redesign or rethink the system, it really needs to be a 24/7, 365. It doesn't. Hospitals don't close on weekends, or if we're going to be discharging people on a Saturday at noon because we're short beds, well, then the care coordinators that are responsible for that need to be working on a Saturday at noon. Otherwise, things are just going to fall through the cracks. And so another example, sort of a concrete example that I could say in terms of being system-centered, and again, this is, it's not a critique, it's just sort of the realities of the system. For example, I can remember sort of, being post-op and having the surgical team coming around on you sort of before they go into surgery for the day. So, your team is coming to see you at 6:37 in the morning, and that's your time in the day to ask them your questions. But between me and you, if you asked me an optimal time to see my doctors and get the answers about what's happening, I wouldn't say that 6:30 in the morning when I've been woken up from the sleep and family, friends aren't there to, especially when you're suffering from a brain injury, that you might need other people to sort of absorb some of the information for you. That definitely isn't the best time of day that I would choose to ask my questions and get the answers that I need. But that's sort of the way that the system is built. But it definitely wasn't optimal from a patient-centered perspective. I didn't get sort of, I found myself actually knowing that teams were going to round on me early in the morning. So I would write down my questions the night before I went to bed, so that when I was woken up and there's that group of people and this is your chance to ask the question, I'd pull out my list. But most people, the moment they wake up, they're not ready to go, right? And ask some pretty serious questions when you're in the hospital. Sometimes these are life or death questions that you're asking. And, doing that at 7 in the morning when you don't have that same support, that's an example where that's not necessarily patient-centered. That's a system-centered sort of.
What makes the team functional, but is not optimal
for the patient. And I don't know how we get, I think there needs to be a complete redesign of the system. And I can't even begin to think about what that would entail. And like I said, it's not a critique of, for example, the time that the team came to see you, but in terms of, is that really what's best for the patient?
Right. Yeah, and honestly, I think one of the main things to come up with solutions is knowing what the problem is. Because, I'm hearing this, and I know I'm not a surgeon, but I know what surgical life is like. They got to hustle, obviously.
Exactly.
They got to go to the OR. But, if they had, whether it's a nurse practitioner or a hospitalist, physician assistant on service that would be able to address some of these needs, answer some of the questions that might come up, and at least, maybe they're not answering everything, but at least some of the big picture items they'll be able to address, that's a fix, potentially. But the key thing though was that having the issue come to be acknowledged, what I'm saying? So no, it's so true what you're saying. And you brought up the term patient partnered. I wonder if you could elaborate a bit on that.
Yeah. So we hear the term a lot, patient-centered. And like I said, before I became a patient, I really thought that I was practicing that sort of, and that means including the patient in the discussions, them being part of their sort of their treatment and that sort of thing. And I do think that was a strength of mine, and sort of not that sort of old school paternalistic medicine, but we've kind of shifted away from that, where kind of what the doctor says goes and that's that. And we've moved into definitely like a multifaceted and a multidimensional healthcare system where, I mean, we've got all the different healthcare professionals that are all working to make the patient better, and which is fantastic. But what I discovered when I became a patient was you can be at the center of everything and still not be included. So care was done to me, not with me. So there was a team of people that wholeheartedly, I know, had my best intentions. Every doctor that was on my team, every nurse that was part of my care, every physio, etc. Everybody was working to try to optimize everything for me from a healthcare perspective and from a medical perspective. But I often, or most of the time, still wasn't actually part of the discussions. It's like that team of people would get together and they'd all kind of say, this is what's best and this is what's going to happen and that sort of thing. Wonderful intentions. And wholeheartedly, like I said, we all have the same goal of wanting the best outcome for the patients, but then sort of still not being included in the discussion. It was sort of like, okay, we're going to send you here and we think that this treatment's good and we'll start you on this medication. And it was kind of the team of experts came in, kind of said what needed to happen and then was gone. So what I discovered was that I was still at the center of the care, but care was done to me, not with me necessarily. And so in terms of the term patient partnering, I mean, from a point of care perspective, absolutely. So that's sort of inviting the patient and including them in their treatment decisions. But beyond patient partnering, that's a cultural shift that sort of recognizes that what the patient has to bring. I mean, ultimately, patients are the ultimate stakeholder in healthcare. Without patients, there would be no healthcare, right? And so sort of valuing them as an equal stakeholder in their care, but beyond sort of personal care decisions, it's partnering with patients at a system and an organizational level and sort of valuing what they can bring from that perspective. And then beyond that, you've got it from a research or a government and sort of a policy perspective, including patients in that level of healthcare as well. So it really sort of, in terms of patient partnering, it's literally what that means is partnering and working with the patients at all levels of healthcare.
Yeah. We recently, from a research point of view, we had this paper on in-hospital cardiac arrest, and the editors at BMJ wanted us to get, the patient's partners actually to get their opinion on what we discovered. And basically the gist of the paper is, your chances of recovery post like in hospital cardiac arrest are low. But hearing what they had to say in terms of like, man, I wish I had no idea. Like basically their input was super insightful. And quite often in research, at least, talking for research for now, sometimes I'll, learn about what outcomes we're trying to measure and they'd be like,
it doesn't matter to the patient.
I don't really care about my hemoglobin A1C or my being X value. Like I want to know, can I go home? Can I be functional? Can I be with my family? Can I communicate? Like all the kind of like things that are important to them. And without that voice, sometimes all this kind of stuff you realize doesn't matter for nothing. You know what I mean?
Yeah. And that so might be different. And so that's where that sort of what matters most to patients, asking them what's important to them. But also that's going to be different for every patient. And sort of another example that I can think of was that I think it's quite common when you initially sort of have suffered the injuries that I have to go initially to an electric wheelchair because it can get you sort of out and moving. You can go further, faster. But I didn't want that. I was sort of a young woman and I was always very active and my mentality from the beginning was I didn't want the easiest route. I didn't want the path of least resistance. I wanted to take the path that was going to get me the furthest in the end.
Wow.
Which might mean it's more difficult initially. So at one point it was sort of assumed that I was just going to start using an electric wheelchair, but I didn't want to use, I wanted to use a manual right from the beginning, because I felt that that was important. That's where I wanted to be in the end, but in terms of my recovery. But that also meant that, whereas if you have an electric wheelchair, you might be able to get out of your room, go down the hall, go grab a coffee and come back. But if, you've been in a hospital for months and you're using a manual wheelchair, that's a victory for me just to get to the door. But that was more important to me than to be able to get into transfer into an electric wheelchair and be able to make it, to the Tim Hortons down below to get a coffee. And because of my brain injury, I had a hard time expressing that initially. So what maybe looked like either being difficult or non-compliant or something like that was actually me just trying to say what maybe most patients want initially isn't what I wanted at that, at that moment. So it took one nurse who really knew me quite well, who kind of just took the time and said, like, what's up? Like, why don't you want to sit in this? And I don't even think I quite realized like what was happening either. But then when we spoke about it, it was like, oh yeah, that makes sense, right? And then once we were all on the same page, we all knew that that was what I wanted. And it wasn't a compliance issue. It wasn't, being difficult or anything like that. It was just that maybe what I wanted was different than what other patients wanted, right? And so, what matters most to patients might be different for each patient, but that's where we have to sort of talk to the patient.
Yeah, or even what I think what you would want
is
not what you would want. You know what I'm saying? So to be able to get that, to come to that realization, we need to have that conversation.
Yeah.
We need to partner with our patients.
Exactly. And a shameless plug, but maybe like a year and a half ago, when I first started kind of processing everything that had happened, I wrote an op-ed for like an article for the Journal of Patient Experience. And I had basically written a tool with the acronym PATIENT that actually could help healthcare professionals in terms of partnering with patients in their care. So in terms of management decisions. And so it's an acronym that literally spells patient in terms of, well, if you're a healthcare professional, how do you partner with patients in their healthcare decisions? But when I talk about that term patient partnering versus patient centered, when I initially wrote that article, in the title, it actually is a tool for patient centered care. And if I had to redo it now, I would actually say a tool for patient partnered care. So sort of the way that I even think about it has evolved in the last kind of year and a half. And so, it's...
it's incredible. I'll make sure to put the paper in the show notes for real. Maybe, Lynn, can you talk to us about some of your work now in terms of being, that patient advocate and that patient-centered, patient-partnered care? Like, what's some of the stuff that you're doing now to really establish that?
Yeah. So, I mean, like I said, I've recently, I have my certificate and diploma in medical education, but when my accident happened, I was finishing my master's. And so I've gone back, and it's all by distance education. So I'm finishing my master's, and I'm actually doing autoethnography of my experience as a patient. So I don't know if you're familiar with what that is, but an ethnography is basically it's qualitative research. So, but it's taking one specific example, but then applying it to a larger sort of cultural context. So, but then an autoethnography is basically the person writing it is analyzing themselves. So essentially, I'm studying my experience as a patient. I'm my sample subject, and then I'm taking what I've learned as a patient and trying to incorporate that into medical education. So it's a very reflective process, but it also really aligns with what I was passionate about before my accident, which was still, medical education. And I think that teaching medical students right from the beginning, I mean, really in terms of valuing the patient voice, and that is going to be a bit of a cultural shift. And so the sooner we can introduce it in medical school, the better. And so that's where I'd love to see the patient experience and an actual curriculum, maybe designed by patients for, that looks at their experiences and where they actually teach the medical students, because they have a skill set that physicians don't have, or anybody else, right? So how do we utilize what patients have optimally, train them to actually be educators? And so that's one of the things that I hope to sort of, incorporate into my master's. But we're doing that right now with a project at the Ottawa Hospital, like a storytelling workshop. And basically, like I've said before, there's power in patient stories. And the capacity for stories to teach people is exponential in my opinion. But how do you teach someone to share their experiences in a way where the people hearing it are going to receive it properly? And so, talking about a medical error that happens, for example, that conference that we were at, that can be a really difficult thing, and to not be angry about it, or to not be, to not point fingers at somebody. So how do you teach someone to see what happened and how that can be used as a learning tool to make sure that potentially that doesn't happen again, but in a way that doesn't put the other side sort of on the defense right away, right? So it's how do we bring sort of both sides together in the middle? Because ultimately, I think patients and everybody in healthcare, we all want what's best for the patient.
Right.
And so this workshop is kind of looking at how do we teach patients who have these powerful stories to be able to curate their stories in a way that they can be used as an educational tool.
I love it, because what people remember are stories. That's what's going to put an imprint on their mind grapes. That's what's going to put an input on their mind. It's going to be something that will stick. And so I think that approach is brilliant. I also think it's brilliant that you're approaching it to medical students that still will be impressionable, that will still have that desire to do whatever it takes to be there for their patients, and not like stubborn old men like myself. But I really think that is the ticket, because I think it's the timing is right. Also, hearing more of these stories on how I don't want to say, maybe it's too harsh, but failing our patients. And you hear these stories, like I said this story once before, in terms of patient experience, but, I recently heard a story about a family that agreed to donate their loved one's organs after they were diagnosed with like brain dead. And, they said no to the liver for whatever reason. And they were devastated. And, as a doc that just deals with the acute side, I had no idea how much of an impact that could have on a family. And, knowing that, you'd want to be better at addressing it, and just like for myself now, after hearing that story, I'm more upfront at saying the plan could be for X, Y, Z, but things can change depending on what they see. And I really want you to be prepared for that, and because it's, as you said, we got into this because we want to help people, and we want to make them better. We want to, reduce their pain, reduce their suffering, but hearing these stories are really, I think, the key to navigating through this.
Well, in the same way, at least I know that when I was, studying in medical school and stuff, it's one thing to learn about the disease, but you always remember that first patient that you saw that had that disease. Yeah. So it's the same idea, right? Everything kind of comes together when there's a story to go with the knowledge.
Absolutely. Yeah. And, good teachers always say at least some of the good teachers I've had, when you're presenting a story or presenting a case, it's like, tell me a story. Like, what was this guy like? What was this patient doing before coming into hospital? What does he do as a profession? Like, just adding these elements of personalizing the patient, and that way for the kids out there, it makes it way more memorable.
From having lived in a hospital for 2.5 years, I can say that, I mean, it can be really depressing at times. I mean, you're stuck inside there's a whole world happening outside of the hospital that you're not part of. And it's hard not to feel like your ailment or to feel like your diagnosis, that I'm just that girl with the heart arrhythmia, with the broken neck and the brain injury. But to have someone actually even just come in, and I know we've heard it before, but to someone say, hey, Lynn, to even hear your name, to talk about the weather, to talk about the Sens game or something like that, talk about something other than just my diagnosis. It means the world. Wow. And that doesn't take any extra time. It doesn't take, any extra training. I mean, that's a tool that we all have sort of at our fingertips, every healthcare professional, right? Mm-hmm. And it's to remember that there's a person lying in that bed. Mm-hmm. And it's not just a patient, it's a person with a story and a history and a background and, life-altering, often life-altering kind of circumstances that have put them there.
That's, I want to say maybe this is the first time I'm hearing this, but as a patient, actually feeling like you are a patient, like losing don't let me put words in your mouth, but like almost like losing yourself or
your identity.
Your identity. Wow.
Yeah.
Like that's. But
then it doesn't take a lot to make me feel like Lynn again. Mm-hmm. To have someone just come in and say, hey, Lynn, it means the world. And, in terms of other things that I would tell, healthcare professionals, things that they can do like today. And this is a very simple example, but it sticks out in my brain because it's so simple, yet it was so compassionate. And I remember a resident had come to see me and then was on his way out. And he said, is there anything I can do for you before I go? Mm-hmm. And, I was still completely stuck in the bed at that point. And my phone had somehow been moved from sort of my bedside to somewhere else. And I didn't want to, ring my bell and ask a nurse to come and give me my cell, I was never that patient that, if the nurse was already there, I might say, hey, can you grab? But I just didn't, I know that everyone's really busy, right? And so, but on the way out, the resident, he said to me, is there anything I can do for you? And I was like, yeah, if you could just grab my cell phone, that would be great. And so he was able to give me my cell phone. And I still remember that to this day. Didn't take him any extra time. Mm-hmm. It's an example that, that showed that he cared beyond just doing his job and sort of seeing me as a patient. It was kind of like, is there anything else I can do for you? And it wasn't a lot, but I remember it to this day. And, just that, the act of saying what, and wow. It was so simple. That was my lifeline. My phone was my lifeline to the outside world. And so, and I needed that. And so I remember that to this day.
No, it's the little things, man. Like the show I did before, with Jen McComb, she was saying how the doctors popping their heads in and just, even though there was not much to say when she had a kid that had cancer and basically saying, just checking in, making sure you're doing okay or whatever. That little courtesy, recognition would just put so much peace in her mind. And it's, like you said, it doesn't take much time. It's a little thing that could just go such a long way for that experience for the patient, and that's why I like hearing these stories, because every clinician hearing this, they're not gonna forget that. They'll be on their mind when the next time they're having these interactions. I know it's been on my mind. And it's not that, I mean, it's just, it's easy to forget these things because, I mean, I see things from both sides, and I mean, it's tough working in healthcare. I mean, it's not easy. I mean, it's a strained system. Resources are less and less, and the demands that are placed on healthcare workers are more and more, no matter which part of healthcare you're in. I mean, it's hard. And so I understand from that perspective how difficult
it is, and how easy it would be to forget some of these little things, and that it's not because someone's not compassionate or that they don't care. It's just there's so much to do and so much of a burden on them. So, if it's more like I say that it's kind of like a reminder that there's a person behind the patient.
There's a person there. That's somebody's brother, sister, mom, dad. Like that's a person going through a tough time.
Yeah. And I mean, for me, like without sounding dramatic, it was a life-altering time, and that was the worst time of my life. So to have someone even just acknowledge my name or say, hey, can I, grab that? Can I grab something for you? It meant everything to me, because I mean, that was the worst time of my life, right? I was the most vulnerable, and little things go a long way.
Yeah. And I think too that, you mentioned vulnerability. That must have been I'm not sure what phase in your illness, but that must have been as someone that was independent and working hard and physically active. That must have been so. It's
a tough pill to swallow.
Yeah,
it still
can't
is.
Imagine.
It still is, and as again, I'm speaking very passionately and very openly, but I mean, I have my good days, I have my bad days. I mean, it's a continual work in progress, and but it's a tough pill to swallow when you instantly lose your identity, and you lose everything that you think made you.
Yeah, that defined you.
Yeah, and I think especially physicians, a lot of the time, part of their identity is their profession, and so what happens when you lose that? What happens when you lose your identity as an athlete? What happens? I mean, there's times where I think about how much my life changed with that accident, and I always say an example was I never got to go back to where I was living before because it wasn't accessible. And so I literally left for work that morning. And when most people move from one place to another, they get to say goodbye. They get to see, I left for work that day and I never went back there. Literally, when I found my new accessible apartment, I paid strangers to pack up my life and then move it here. And I mean, just even that, just think of how difficult that would be to not sort of say goodbye to where you lived in your old life. And then all of a sudden just be in a new world and a new environment and trying to figure out how to live completely differently. I mean, it's very, I still have a hard time wrapping my head around it a lot of the time. And yeah.
I think that's completely understandable. I hear you, what you're expressing, and personally, I can't imagine. I literally can't imagine the vulnerability, the resilience that it would take, the physical demands. You're obviously a special human being to be able to
thank you.
And an inspiration for real.
I think most people would do it though. I mean, you don't realize what you're capable of until you have to.
But Lynn, fair enough or whatever. You don't know what most people I think are capable of doing more than they think. But I think you and I have both seen both sides where people have gone through similar episodes where that will isn't there, that drive isn't there. They get chronically almost institutionalized because of that lack of drive. So, and they're not out there voicing advocating for patients and so on. So it's.
I've been lucky though as well. I've had some. I mean, some of the people on my healthcare team. I mean, I wouldn't be where I am today were it not for the phenomenal people, and not just physicians, but nurses and physios, everybody, social workers, everybody. I mean, there's some phenomenal people that I wouldn't be here today if it weren't for them. And some I mean, So, I mean, I appreciate that you're crediting me, but I have to credit some of the people that are part of my care as well. And, you know, some of my wonderful, like, close friends. And I mean, it's hard to, I've read a lot about the psychology of sort of seeing people become ill. And I even see it from somebody else's perspective that you see the vulnerability of human life, right? And so that could be hard for a friend who's of my age group as well, to sort of see someone all of a sudden almost like lose everything and have to kind of start over or learn how to recalibrate their whole life. And, you know, I can't even imagine how I would feel if I saw that happen to like a family member or like a close friend or something like that. It would be tough because you realize the fragility of human life.
Yeah.
Right. And I mean, I think maybe we see that as physicians, but outside of that, often people don't see that day to day. Right.
And also, like, without experiencing it, even as physicians, without experiencing it yourself, like, I think it doesn't always register how fragile life is, you know?
Exactly.
So I think what you're saying really, I think there's a lot of truth to that.
Yeah.
We're talking about solutions and how our current healthcare system could be quite siloed and navigating through healthcare could be difficult. Have you thought of any way of overcoming this? Like, were there some kind of ideas that came to mind as you're seeing how shitty some of these circumstances could be?
Well, I mean, one of the things that I kind of see is that I feel like our healthcare system is beyond the point of patchwork or Band-Aid.
Right.
Like, and that's what we're kind of trying to do right now is we're putting Band-Aids on things. But I think there's almost a bit of a system redesign that needs to happen. I don't know how that would happen. I mean, and that's a whole like political government, you know, like there's so many levels for that. But there almost needs to be some massive redesign. But I mean, I truly wholeheartedly believe, and I've seen that patients can be a huge part of the solution. And I know I've said it before, but listen to them. And they have a lot of expertise to bring. But the other thing I would say is I'm a huge believer that a unified electronic medical record, you know, for example, like one unified one for Ontario or something like that.
Isn't it kind of crazy that this doesn't exist in
It
2019?
Isn't it crazy that we still, like, as doctors, we get paged, we send faxes for, right? Like, who faxes anymore?
Yeah.
Like, outside of healthcare, right?
And yeah, like, it's crazy.
But it, you know, and an example is, I mean, patients are, like I said, it's hard to navigate the system anyway. But when there's pockets of information missing, I know, I mean, I think this is where I've often said that I don't know that I'd be able to be where I am today were it not for my medical degree, because I have so many active health issues that it really is hard to manage. And I've often said that I feel like my MD is just helping me to be able to survive myself. But in terms of the gaps in the system, I can fill that in because I understand what's happening. I have an understanding if my electrolytes haven't been done in a certain amount of time, and I know to kind of speak up and to sort of ask. But for example, if there's a consult from somebody that sort of lays out recommendations and that consult doesn't get to your family doctor, things might fall through the cracks, right? And whereas if you have one unified system, I think we'd save money because for all the times that, you know, you get blood tests done in a hospital, but then you're out in the community and they redo the same thing because
CT scan, MRI, all that shit's getting
we would be
redone.
saving a lot of money because records from the hospital don't get out to the community. And so you almost have like two separate kind of records. But even within hospitals, I recently had to have a consult outside of Ottawa. And so getting the consult from a different city to come here, it took weeks and sort of, I couldn't track it down myself. The hospital had a patient portal, but I couldn't access it because to get access to the account, you have to actually physically go to that hospital, but it was from out of town, and it was actually a teleconference. So I was never actually out of town. So I couldn't get access to, the online, patient portal. But then as a patient, I couldn't request the consult, even though it was supposed to be sent to all my doctors here. And I was able to take notes and absorb the information, but your healthcare providers need the consult, right? They need it. And it took weeks, and being admitted in hospital and sort of having an inpatient physician who was overseeing my care request it from this other facility. Then the consult finally came, and it was able to be disseminated to all the different sort of people that needed it here. But I mean, just that one consult that had so much information was so difficult to get.
Yeah.
But I mean, just how easy would it have been if we have one unified electronic record for the whole province, right? It's all there.
It's crazy. Like I'm originally from Alberta. They're doing Epic in the whole province, and I'm like, kudos, yo. Like, this is the way of the future. This is how you will save money, improve quality of care, improve the patient experience.
You see the silos, you see all these things, but if you just have one set of data, it seems so simple. Yeah, we can't get there.
I mean, if I ruled the world, you know what I'm saying? Like,
we'd be there.
What I would say is, like, stop asking questions. Just do it.
Yeah.
You are getting this EMR, whether it's Meditech or Epic, whatever. You make this decision, Ontario government, and that's it.
Yeah.
Full stop.
Yep.
We'll deal.
Yep.
You
have to tear off the Band-Aid.
Yeah. No, and it's been done, and it's like, I mean, in
it's
Toronto,
done in other countries.
Yeah, exactly.
Right.
It's too bad.
I mean, other countries, you don't even have like a health card, right? Like, everything is all electronic. Like it all. Yeah.
You think 2020 coming up in here. The other thing that came to mind as we were talking about this is, I know some centers have like patient navigators, like basically hired people that helps you navigate this crazy system where they help make sure that you're on time for your MRI, and let you know, make sure that consult got to the family doctor and all these things. And I just thought, when I heard this, I just thought how brilliant it would be, because honestly, with a medical background, it's still tough to navigate, as you've well articulated here, But yeah, because you always want to try and think of solutions to some of these.
And again, someone might say, well, then that's going to cost money because you have to hire someone to help. But what about the cost of somebody that doesn't show up for their MRI because they were told to go to one place, or they forgot about, or something like that, right?
Or just visiting going to Emerge because they couldn't find a prescription for XYZ.
Exactly. So,
you know what I mean? Like, there would be
I think that we have to just, I don't know, there's something about healthcare where we're really resilient to try new things, right? We get so stuck in.
Don't even get me started on this. It is insane how resistant we are to change. Yeah. It is unbelievable.
Yeah.
From all aspects, from your little division, department, university, I'm a big believer of do what you can, do it, and then ask forgiveness later, because in medicine, nothing changes, man.
Except guidelines.
Yeah, guidelines that are like
medications, all that stuff. I mean, it's changing every day.
And then you look at the evidence behind it. I don't want to get too
exactly.
Nitty-gritty.
That's a whole other podcast.
yeah, absolutely. Lynn, we're getting to the end of the interview, and I'm wondering if you could give any advice to patients that are, whether it's going through something similar to what you've gone through, or any difficult time, knowing what you know now. Would there be anything that you would want them to know?
I would want them to know. That's really good, because it's a good question, because I often get asked, because of my training and my background, what would you tell physicians or other healthcare workers? But, like I've touched on, I think I've had an experience as a patient that most people won't ever have in their lifetime, in terms of the intensity and literally the fact that it's been kind of my full-time sort of, not job, but I've been living it full time since the accident happened. And so, I mean, one of the things that I would say is that don't beat yourself up. It is a difficult system to navigate. It is a difficult time. But I mean, we've probably heard it before, but you're your best advocate. You know yourself best. And we talk about sort of patients being experts of the system, but also who's the expert of yourself, but yourself, right? You know yourself best, and be your advocate. Be your own advocate. Empower yourself with as much information as you can. Ask questions. If something doesn't feel right, I mean, medicine, healthcare, mistakes happen. It's human, right? It's subject to human error. So don't be afraid to ask questions, to want to know what your options are, to want to know if you're given a medication and you're not told what it's for. Ask if you don't necessarily just have to take something. If you're not sort of, don't be afraid to empower yourself, I guess, with as much knowledge as you can. Take whatever help you can get, and because it's hard being a patient, and whether that's help from family, friends, whether that's help from the system itself. I wouldn't be able to do this podcast if I wasn't sort of accepting the help that people are offering to me, whether that's from healthcare providers or from friends or anything like that. And I was a pretty stubborn person, so it's hard for me to accept help, but you have to. And no matter how hard you try, you can't carry the weight of the world on your shoulders. And it's okay to be vulnerable. It took me a long time to sort of be okay with not being okay on certain days. It's like, what has happened is not fair. It's tough, it's difficult, and life is hard today. And that's okay that I'm feeling like that. I'm okay if I have a day like that, because it is hard and it is difficult. You can't stay stuck in it. But if I want to have a day where it can actually be kind of therapeutic sometimes to sort of, it sort of, no matter what, if you're dealing with any sort of difficult situation and circumstance, I think of an example, if you lose a loved one, if you don't have days that are terrible, you're not processing it at all. Right. And so it's hard being a patient, and, easier said than done, but be easy on yourself. And yeah. No, no one has ever asked me that question, because I always get asked. So I'm going to think more about that, because I've always been asked, what would you tell healthcare providers? But I've never had to, I've never thought about what I would say to, but I think what comes to the tip of my sort of tongue is that I would say one of the biggest lessons I've learned is that sometimes it's okay to not be okay. And that's okay.
Yeah. No, everything you're saying just makes so much sense. Even I can't count how many times, hearing a patient express something along the lines of, I can't tell you what it is, but just what you're saying, like, this treatment doesn't feel right, or something's not on. And 94% of the time when they're expressing themselves like that, they're right.
Yep.
And so being that advocate for themselves, and not being shy to express when things don't seem right or there needs to be change is paramount.
Yeah.
And so I'm glad I asked, but I'm glad to hear the answer to that, because that's what we're about, trying to make things better. So Lynn, once again, I'm going to say this. Thank you for doing this. Thank you for being the warrior that you are and advocating for patients. Thank you for allowing me into your home and having this amazing discussion, which I hope will really create some awareness and improve care that we're providing our patients, because that's what it's all about. You know what I'm saying? And this was fun.
I'm getting teary-eyed as you're saying that. Of everything that I've spoken about now, is sort of when you're saying thank you, that's when I'm getting emotional. But it's my pleasure, and as hard as everything the last 6 years has been, I've learned a lot, and I've got a lot to share, and I think I can still make an impact and an imprint. And so I appreciate you giving me this platform. Appreciate, what you do for patients. I always appreciated every healthcare worker, but I think and having been one myself, I understood the sort of demands, but also being a patient, I observed how hard it is to work in healthcare. So I'm grateful for every healthcare worker out there, every physician, everybody. So thank you.
Thank you. And I can promise you this, you're going to leave a fat imprint on this bad boy. So don't worry about that.
Thank you.
Thanks so much. Thanks everybody for listening to episode 12 with Dr. Lynn Ashdown. Remember, that patient voice matters, at all levels. And whatever we could do to make sure that that voice is heard is paramount, guys. If you want to leave any comments, leave them at Kwadcast99@gmail.com. Follow us on Twitter, Facebook, Instagram, or YouTube.